Yeah, let's bring into this conversation clinical director of the Division of Infectious Diseases at Brigham and Women's Hospital, Dr. Paul Sachs. Dr. Sachs, it's good to see you again. I want to ask you about death rate first. We've got a lot to get to, but the president zeroing in on the mortality rate, saying it's the best anywhere in the world. That's not true. But what do you make of the argument, which is true in many cases, that we're getting better at treating this, that getting coronavirus is not a death sentence? We talked to director of Houston Methodist Hospitals yesterday, who says his patients are getting younger. Fewer of them are going into the ICU and the ER. But what about this focus on death rate, which Dr. Fauci calls a false narrative?
Well, not surprisingly, since I'm an infectious disease specialist, I do agree with Dr. Fauci that there has always been, and we've recognized from the very start, a very broad spectrum of illness from COVID-19, from very mild illness to very severe illness. And this severe illness can actually occur in young people as well. As has been mentioned, some of the young people who get this become critically ill and some even die. And that really are deaths that we should not be experiencing. So I very much agree with Dr. Fauci that this is a false narrative. I also think that we may see an increased death rate in the coming weeks to months that hasn't yet occurred because deaths often lag behind new cases by several weeks.
And what's your read on these spikes? California, Texas, several other states yesterday set their daily records for the number of cases of coronavirus. Is that a factor of reopening? Is that a consequence of masks not being mandated? What do you see as behind all this?
It's a combination of factors. We've known, again, for some time how this virus spreads. It spreads most efficiently in indoor settings when people are congregating in bars and restaurants, in houses of worship. Those are all places where lots of people get together without masks and potentially transmit the virus to others. By opening too early, before we really had an effective testing and isolation program, we ended up allowing the virus to spread in these communities and eventually seed these communities and cause these surges. We experienced the same thing in the northeastern United States earlier in the pandemic. Fortunately, we know how to get it under control, as seen in the declining numbers in the Northeast and some other regions. But it's not easy. It means mask wearing in public. It means not opening bars and restaurants and religious settings. As I mentioned, being very careful with schools. I think schools are important, but they have to be opened very carefully and not just pretend that this doesn't exist.
We know from the beginning of this that testing is so crucial to our understanding and getting our arms around coronavirus. We've heard not just from President Trump, but from others who've said, well, of course you're seeing a large number of cases because we're getting better at testing. Therefore, we've identified more people who have it. And that's why you're seeing a spike in the numbers, because we're doing a better job testing. What's your response to that?
Well, I think we could do a better job still. Unfortunately, some of the regions that are hardest hit with COVID-19 right now are recapitulating some of the difficulties we had with testing in March and April in other hard-hit areas. So there are long lines to get tested. There are long delays before people get the test results. What would really be transformative is if we could have an inexpensive, rapid home test so that we could expand testing to not just those of people who have symptoms, but people who are potentially asymptomatic or pre-symptomatic and could spread the virus to others. I think that will be a very exciting development. Many companies, many academic centers are working on this. It's something that I really am hopeful we're going to see in the next few months.
All right, clinical director of the Division of Infectious Diseases at Brigham and Women's Hospital, Dr. Paul Sachs. Dr. Sachs, thanks for your perspective this morning. We really appreciate it. Let's bring in.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.